Hi, it's Dr. Centeno, and today we're going to learn about how kyphosis can mess up the measurements in the neck and how that impacts craniocervical instability, or CCI. So what is kyphosis? You know, you probably have seen that if you look at most young people, well, that's not even true today, but a significant portion of young people are kind of born this way, young adults. Now, if they tend to look down at a computer screen all day or a tiny little phone, they tend to get this forward head, forward neck posture and a rounded upper back, and that's called kyphosis. Now, there's a number of different reasons that happens. Obviously, one we talked about, looking down at a phone all day doesn't help. You can have bad genes, meaning there are people that are born with genes that code for more kyphosis. And you can also have a compression fracture in the thoracic spine that pushes you that direction. Now, I'm going to show you a guy with a compression fracture. This is a relatively young guy who got this compression fracture with a rock climbing fall. It's right there. You can see that this vertebra is a nice square, but that this vertebra here is more of a trapezoid. And what that does is that dramatically increases the curve in his thoracic spine. And this is his neck off to the left, and you can see because of that, the whole base of the neck is pushed forward. Now, in order for him not to look at the ground all day, he's got to be able to then increase the neck curve. And you'll see in this last image what that tends to do is it tends to push the dens backwards. And that actually now puts some pressure on the brainstem and upper spinal cord, giving him sort of functional craniocervical instability, or at least compression of that area and neurologic symptoms. So as you can see, because his thoracic spine is messed up, his neck is messed up, and because of that, he's having issues. So again, kyphosis pushes the head forward, the neck curvature increases to compensate, the dens is forced backward. That can lead to irritation or compression of the brainstem. Now, even if that's not the case, just having this forward head messes with your upper neck ligaments. So what that does is that tends to put pressure this way, and that means it starts to stress out the transverse ligament here and the alar ligaments as well, because they tend to go backwards and resist flexion. So if you've got this kyphosis, you're hanging on your upper neck ligaments, which is putting extra pressure on them. And if you've got CCI, that's not helping at all. So if the patient has CCI, that can be treated, but realize the kyphosis needs to be addressed. And if it can't be fixed due to a fracture or a long-term change in the shape of the vertebra, like the guy showed, then there's always going to be extra forces on those upper neck ligaments. So in conclusion, kyphosis is a big deal in our modern device-laden world. And if you have CCI and kyphosis, we really need to get the kyphosis under control in order to help your CCI. So thanks so much for watching. Hope you learned about kyphosis and CCI, and have a great day.